Hello, hello. Okay, let's hope this is working. This Facebook is apparently experiencing an outage. Uh, I'm trying to see. Nope, it is literally not going live. So I'm just gonna record this and put it up later. I am so sorry about the inconvenience on everything, everybody. Facebook is apparently down, and I am going to just record this on Restream and post it later for you guys. So I really was wishing to be live with you today, but of course that's not working that way. So we're just going to make it do what it do, and I'll get you this information as we go. So today we are talking about ashwagandha and 5-HTP. Both of those supplements are used for depression, anxiety, and even sleep. So we're going to kick it off with ashwagandha first, and then move on to 5-HTP. So ashwagandha is, I know it's a really weird name, and I believe when I started seeing it first come on the scene, and it's always been around, but been seeing it come on the scene with more popular usage when the gummies Goli, that particular company, had their apple cider vinegar, but they also came up with the ashwagandha gummies as well to help people sleep. So um, this time of the year can cause a little bit of anxiety and anxiousness and things like that. So I'm just going to take this opportunity to talk about ashwagandha and 5-HTP and see if that can help some people who are going through some rough times during this holiday season. Now, ashwagandha is an evergreen shrub that's cultivated in tropical areas of Asia, Africa, and Europe. And y'all, please don't mind my voice at this moment. It's been a little scratchy lately. It's been a little scratchy. So now the name is really weird, as you know, I said that already. But the reason that the name is weird is because of the way that the root smells. So the root smells like a horse, and because of that, that's how ashwagandha got its name. It's not typically ashwagandha, is there is another long name for it, which I'm not going to try to pronounce. But if you want to Google, look it up. Just hit Google. So Ashwa means horse and Ganda means smells. So that's where that, because the root smells like a wet horse, that's how it got its name. Most products are made from the root extract, but there are also products made from the leaf extract. So there are two extracts, one root, one leaf. Um, Majority of products that are made commercially come from the root extract, ashwagandha. Also, it is currently and most commonly promoted for sleep, stress, and anxiety. So I have not personally taken it. I do not know how well it works. I have had some people say that it works well. I have some people that said that it doesn't work as well as they thought that it would have. Um, but again, everybody's different. Everybody has different, different DNA. Everybody has different effects on their body. So what may work for one person may not work for the next. Now, for stress and anxiety, the dose is typically 300 milligrams to 600 milligrams once a day. That has been studied for that particular dosage to see if it actually works for that, and it actually does. Now, for sleep, it's shown that 600 milligrams once a day for 8 weeks. That particular study was done for 8 weeks, and it shows that it was effective for the improved sleep time, time to fall asleep, and quality of life. It improved all three of those areas during that study, and that was at a dose of 600 milligrams once a day for 8 weeks. Excuse me for a second. Throat's getting a little parched. So, side effects. What is going on with these side effects for ashwagandha? You can expect to have an upset stomach, loose stools, diarrhea, nausea, drowsiness. Now, drowsiness is kind of one thing that you would expect because, again, this can be used for sleep. Um, it is not safe in pregnancy or breastfeeding. So you need to avoid that if you are pregnant or if you're breastfeeding. You do want to avoid ashwagandha. You also need to avoid this particular supplement if you have liver damage, thyroid conditions, or prostate cancer. Those three things were specifically mentioned. If you have liver damage of any kind, whether it's been medication induced or something else that's going on, liver damage, you want to stay away from ashwagandha. Thyroid conditions. So if you have hypothyroid or hyperthyroid, anything that's dealing with that endocrine system, you want to stay away from this as well. And then of prostate cancer, it did not mention any other cancers in when I was doing the research for this, but prostate cancer was specifically mentioned. So if you have prostate cancer or history of prostate cancer, you want to stay away from this supplement as well. It has been shown to be tolerated for well up to 3 months. So just keep that in mind. Um, Now, I know we're always looking for safe choices for our kids to sleep. Ashwagandha is not one of those. There has not been anything that shows that um, children are able to take this one. The research is very limited in children, so we want to avoid it in children, even though it is a natural supplement. And there are risks with in medications. That's going to be anybody that's taking an anti-diabetic med. You will probably want to stay away from ashwagandha as well because it can induce a probability of hypoglycemia, which means it'll lower your blood sugar too well in combination with those anti-diabetic anti-diabetic meds. My goodness. Okay. Same thing with hypertensive meds. So if you're on anything for hypertension, for high blood pressure, then you want to stay from away from this one as well because it can lower your blood pressure. At least it's thought to lower your blood pressure. Um, as far as sedative effects go, if you are taking something to help you go to sleep, or if you're actually taking another anti anxiety medication, antidepressant, anything like that, you want to stay away from ashwagandha as well because there will be an additive effect more than what you would want it to be. And sometimes that additive effect can be dangerous. And last but not least, actually not last but not least, specifically benzodiazepines. If you are taking anything like alprazolam, clonazepam, anything that ends with that pam, temazepam is actually used specifically for sleep. You want to avoid any of those combinations with ashwagandha because it can cause increased effects. That will mean slowing your breathing rate down substantially. It would also mean making you feel sleepier more than what you normally would and possibly having a hard time getting up the next morning. So just keep that in mind. And then there's a decrease. Um, it can decrease the effectiveness of immunosuppressants. So if you're taking anything from having a transplant, or even if you're taking just prednisone for certain disease states, uh, prednisone is considered an immunosuppressant. So it's also a steroid, but it's also acts as an immunosuppressant as well. Um, you want to make sure that you stay away from ashwagandha as well. Typically, I would say if you're a healthy adult and you're just having some trouble, going to sleep, or you're a little bit more anxious around the holiday times, it doesn't hurt to take this one. You just need to make sure that you don't have any of those health conditions that I just mentioned: diabetes, hypertension, transplants, prostate cancer, pregnancy, lactating mom. Any of those, you want to make sure that you are staying away from ashwagandha. Um, and that's it on that one, I believe. So that went by a little fast. I know I'm probably talking a little fast, faster than what I normally do. just because I'm recording now, and when I'm recording, it gives me a certain time limit. So if there's anything that you missed, please go back and listen to it again, or even, send me a message or something of that sort. All right, so there's 5-HTP. Not many people know about 5-HTP, but it's one of the, I would say, better choices when it comes to anxiety that's over the counter, just because of the way that it's made. Now, 5-HTP, the actual name is 5-hydroxytryptophan. If you ever heard of tryptophan, that is, very a common thing to hear, because tryptophan is what's related to melatonin. It's also related to that theory of drinking warm milk before you go to bed. So whenever you heat up milk, it releases tryptophan, and tryptophan is like, it relaxes you. So that's why people will tell you to drink a glass of warm milk. I know you've probably seen it on TV, or something of that sort. Now, L-tryptophan is a byproduct of, um, I'm sorry, 5-HTP is a byproduct of L-tryptophan. I said that backwards. So 5-HTP is a byproduct of L-tryptophan. And what that's important, because L-tryptophan is a building block for proteins, but it also helps you to rest well. So what does 5-HTP do? Well, 5-HTP increases the production of serotonin. Serotonin is one of your happy transmitters. I believe I talked about it not too long ago, but it is a happy neurotransmitter that gets put into your, that's already in your body, rather. And when you increase that level, it's supposed to make you feel better. So it can, that's neurotransmitter of serotonin, can help you sleep. It affects your appetite. It affects your temperature, pain sensation, and even sexual behavior. So serotonin has an effect on all of those things, and 5-HTP would be related to treating certain things in those areas as well. Now, what have we seen it used for? It has been used for depression and anxiety. It has been used for depression and anxiety. The doses can be taken up. What they have studied is, um, what's considered safe is up to 400 milligrams once a day for up to a year. That's considered a safe dosage. Outside of that year, sometimes I don't think it's quite necessary, but it can be taken for up to that year. If you're having a hard time um, with anxiety, depression, that type of thing. The typical dose for 5-HTP is 150 milligrams all the way up to 800 milligrams once a day. Now, that 800 milligrams is a very high dose. I don't see people taking that much of it. Typically, I do see people sticking around to the 100, 200, 300 range, sometimes 400. But above that, I rarely see people taking that dose. And I would say, as with all supplements, you always want to start off with a smaller dose and then increase if you absolutely need to. Now, there are side effects. Anything that you put into the body is going to have a side effect. It could be, anything. If it's not naturally in your body, then most likely it is going to cause some type of a side effect. Now, for 5-HTP, that can include heartburn, stomach pain, nausea, vomiting, diarrhea, drowsiness, um, muscle problems, and sexual problems. So just keep those in mind, that there are some side effects that are attached to 5-HTP. Large doses of this supplement over 6 grams, which I would hate to see anybody taking over 6 grams out. There's no reason why you should, but just to put it out there that over 6 grams is not safe. It's actually harmful. Um, 5-HTP is not safe in pregnancy or breastfeeding. And if you have a child that is under 12, with your pediatrician's permission, it can be given to children. Um, The dose on that for children would be 5 milligrams per kilogram per day. So you would need to know how much your child weighs in kilograms, and then someone can do the math for you. But that will be the typical dose. If you need me to do the math, go ahead, inbox me. I can do that for you. But I do need to know what their weight is. Um, Pounds are kilograms because we can convert the two. So 2.2, I believe it's 2.2 kilograms that equals 1 pound, or vice versa. It's one of those things I don't normally have to spit out. I just actually do it. So, also, you do not want to take this before you go to before surgery. Any type of surgery has a possibility of medications that are used to increase the serotonin, and this medication or this supplement does indeed increase the serotonin as well. So, um, there are some drug interactions. Number one would be carbidopa. Now, carbidopa is normally used for Parkinson's. Um, in combination with 5-HTP, you can experience rapid speech, anxiety, and aggressiveness. So it'll be doing just the opposite of what you would want the 5-HTP to do if you are indeed taking carbidopa. Same goes, well, not same, but there's an interaction with CNS depressants, central nervous system depressants. What that would be is anything that causes sleepiness or that you're taking to go to sleep. Anything that you are taking like an antidepressant to help you feel better. Um, on any pain medication, that's another, CNS depressant, because your body doesn't stop feeling the pain. How can I put it? Your body is not feeling the pain because the medicine is telling your body not to feel the pain. So, along with that comes some of the system being, um, some of the functions of your body not working as well. And that's where that CNS depression comes from. So, it slows your heart rate, it slows your breathing. And you don't want to couple that with you don't want to couple that with the 5-HTP, because it could possibly do the same. Um, if you are on any antidepressant like Lexapro, Prozac, um, Cymbalta is a new one that's highly prescribed, Paxil, all of those are considered SSRIs. And what we call that is a serotonin reuptake inhibitor. What it means essentially means is that it's putting more serotonin in your system. Now, 5-HTP increases serotonin levels. So if you take those two together, then you are overloading your body with serotonin, and then you can end up having something called serotonin syndrome. Serotonin syndrome is typically present with seizures, vomiting, and things like that. Um, Not only can you have that happen with SSRIs, but you can also have it happen with other herbal medications that are used for depression and anxiety as well, such as black seed, SAMe, um, St. John's wort, and L-tryptophan. So if you're going to do 5-HTP, you don't need to do an L-tryptophan supplement as well, because you'll be overloading your body with too much serotonin, and then you can have those ill effects from it. And last but not least, melatonin, L-tryptophan, valerian root, they are all used for sleep therapy. If you add 5-HTP along with that, you can experience more drowsiness than what you would normally experience. So just want to get all of that out. I have had some technical difficulties today, so I do apologize. Apparently, Facebook is down right now, so it's not letting me do the live stream, but this is a recording. If you do have any questions, you can always hit me up, send me a message via Messenger, or you can go to my website and send me a message there. It's www.drravinpharmd.com. Also, you can, I mean, there's a bunch of things that you can do. A bunch of things that you can do to get in touch with me, and I will respond just as soon as I possibly can. I thank you guys for hanging in there with me today. It got a little frustrating, but that's okay. We still got the information out that you need to know, and that is always my goal. If you are interested in buying any of my shirts or t-shirts, sweatshirts, hoodies, mugs, cups, you can head over to the website. If it is a t-shirt, sweatshirt, or a hoodie, long sleeve shirt, any of the apparel, you can actually DM me. I'm actually making those at home now. Mugs, mugs and tumblers and the notebooks, those can be ordered from the directly from the website. But if you want to purchase any of the Christian apparel that I have, giving all glory and honor to God, if you want to purchase any of those, you can go ahead and inbox me with the color that you want, the size that you want, and I'll let you know what that looks like. Thank you for your patience during this transition, uh, from taking the shirts off of the website to me doing them now. And I pray that you guys have an amazing day. Again, I do apologize for the inconvenience of not being able to go live, but I'm going to get this information to you any which way that I can. Don't forget to like, tag, and share, and follow all of my social media outlets. I'm under Dr. Raven PharmD, a majority of them, I believe. TikTok is the only one that says Doc Raven. Um, and I will see you guys next week, I believe. We'll see if this if all the kinks have been worked out by then. I love you guys. You have an amazing day.